Hi, I'm Lori Handy. I'm the Associate Director of the Vaccine Education Center at CHOP and a pediatric infectious disease physician. Yeah, I love that question because it really gets at, what's going on there, right? The family is trying to figure out who they trust to get their information. And they may just be meeting a provider for the first time. They may have heard a lot, from their aunt or their cousin or someone that they really, really trust on most things. And they're now just meeting you. So, when you have families that are hesitant or say, I'm not sure or not yet, the goal of that interaction is not to say, I'm going to convince you today to get vaccinated. The goal is really to let that family know we're building a relationship, we're establishing trust. And what does that mean to establish trust? That comes with saying, like, I have credibility, I have compassion for your child, I have the character of a person that you want to be working with. And you have to show those things. You don't just get to have them. You have to earn them. And so, compassion may be saying, I hear you need more time. Let's revisit this in a month. Really just saying, I see you. I know what you need. Or, if it's maybe a sick visit and they say, I don't want to vaccinate because my child's sick. Now, as a pediatrician, you might say, it's perfectly safe to do that, but here's a family that needs to see something else first. And so, you're able to say, let's care for your child. Let's make sure they get better. And then we're going to book you out for a week from now to make sure he's better. And if so, we can do vaccines then. So, you're letting them see and know you're a trustworthy person. And that follow-up is so, so, so critical because they are building a relationship with you specifically, not your practice, not the name of your hospital, but you as a human. And that we kind of can't take for granted. So if you do say you're going to come back and see me in a week, it really has to be you in a week. It can't be your partner, or you can't drop the schedule and not schedule it, or forget to call them back. So I think that those things are really important and maybe a little lost in our current healthcare system. It's very hard to keep those longitudinal relationships, but I think they're really critical in this area. So I think that pediatricians, really healthcare providers at large, have a couple different opportunities for communicating. Some of that is that kind of one-on-one patient in the office. Some of it is more at a practice level, sending messages out or having a social media account. And some of it is more of our public health system where we're saying the city of Philadelphia, in my case, or the state of Pennsylvania. The messaging around the benefits to communities, I think, really falls in those second two, right? Coming from your practice at large or coming from public health authorities at large. And we want that message because it's an important message to know and to be aware of. And, healthy communities is something we all care about. And I think that every parent can kind of get behind. I do think when we're in that one-on-one provider patient interaction, that focus right there is on that child. Because if a parent is hesitant to vaccinate, their daughter Sophie in front of them, you're not going to convince them or talk them into vaccinating Sophie on Johnny's behalf, right? They're vaccinating Sophie for Sophie. And the cool thing about pediatric vaccines is, like, 100% of vaccines benefit the individual child. We don't actually have any vaccines that we're administering to protect people around them, the way maybe we're giving a maternal vaccine to protect the baby. For kids, you're protecting that child. So I think that's really the focus of that one-on-one conversation.